Welcome everybody to this week's Maternity and Midwifery Hour. Welcome, welcome, welcome. This is the last in the series, and every single week we have something fantastic, and this week is no exception at all. My name's Sue MacDonald and I'm the curator, I love that word, of the Maternity and Midwifery Hour and the Maternity and Midwifery Festivals, and it's my pleasure to be chairing this evening's session. And I'm joined by Dana Colburn and Sam Perry, and they should shortly appear on the screen with me. There they are. And we always do this to our lovely guests, is we start them off with asking them for a nice moment of the week. And I'm going to start with the birthday girl, our Sam Perry. So Sam, your moment of the week. Please share it.
Thank you, Sue. Yes, so it was my birthday yesterday, and I think my moment of the week is my husband got me theatre tickets for a show I've been wanting to see for years, so I'm really excited. And I'm going on Tuesday.
And that's close enough to your birthday that it really does feel like a birthday treat.
Absolutely. It's not months down the line. He did very good at planning.
Though I think birthdays should last longer than a day, personally. I think we need to stretch them out. Quite right. Thank you for that, Sam. Fabulous. And Dana, can you share your moment of the week?
Yes, I'm maybe a little bit sarcastic here, Sue, if I can. Hopefully it will be a bit funny. My husband travels, so he has gone away the first week of the Easter holidays and left me with two teenagers. But the highlight of the week is I had highlights done. I had my hair done. I feel a new woman.
Fantastic. It's those things that make a difference for us. Well, those are fantastic ways to start with us. Now, before we move on to the main meat of the, and sorry for the vegetarians amongst you, the main part of the evening, I'm just going to remind you where the Maternity and Midwifery Hour came from, just for anyone new with us this evening. We've been around now for 3 years, and that's because we started when the pandemic started and with lockdown, where we realized that midwives and student midwives needed some manageable and digestible form of getting information and education and continuing professional development at a time when we couldn't have study days, we couldn't have conferences, we couldn't have festivals. So we started the Maternity and Midwifery Hour, and we're still here. And it's been, I suppose the subjects have changed a little bit, but I have to say, for me, the theme has been from the very start that we've had some superb speakers, most of the midwives talking about innovations and practice changes and the things they're doing in day-to-day practice, education, clinical, whatever. And it's been fantastic and a real privilege. And tonight will be no exception. And of course, if you are a midwife looking at revalidation and getting out all your papers, just have a look at Matflix, because this evening, just like every evening that we do, and all the maternity and midwifery festivals, is recorded. Everything is recorded. My colleague Neil Stewart will, I'm sure, tell me how many thousands of hours we have now, but it's a lot, a huge bank of information. So if you're doing any project work, if you've got assignments to do, if you've got revalidation, have a look at Matflix. It's free unless you want to have the subscription, which is also fantastic, where you can have actually quite focused box sets to access with lovely reflective activities, which is designed by our lovely Jenny Hall. You can access that, but everything can be free, and you just access this enormous amount of information from people and use it in your revalidation or just to update yourself. It's fantastic. And we love you to share. So if you enjoy this evening, which I know you will, share with your colleagues, students, anyone who's in maternity care, because that's who it's for. And I want to say a big thank you to our wonderful students and our wonderful midwives and our colleagues in maternity services for all the work they're doing now. It's a hard time. And I keep saying that, but it continues to be a hard time. We're a bit short of staff. They keep changing the numbers of which we're too short of, and it varies from anything from 2,500 to 3,000. It feels like more to me that we need. And I'm hoping that in the future, when they come up with the workforce kind of plans, they might have a really good, proper number that we can really provide our excellent care and not suffer the shortages that we have now. So a big thank you to everyone who's working away, and look after yourselves. And I'm going to say that at the end as well. So take it seriously. Now, this week, I have to do my little news features. It's still Ramadan, and I'm learning all about Ramadan a lot better. And some of that is a big thank you to Fatima Mohammed, who's got a lovely article on fasting and Ramadan during pregnancy and breastfeeding, a personal journey, and that's through the Maternity Midwifery Forum. Really interesting, and you get a different view about it. And we talk a lot about this in the media. Oh, it's Ramadan and the people are fasting, and people have lots of ideas about it, that these folk who are Muslims are not going to eat for a month at all. But of course they do, but it's in a different structured way, and it's a very important time for Muslims and very spiritual, and there's a lot to be learned. And that article I would really advise you to have a look at. It's really good. Also, it's Passover from today until about the 13th of April, and of course it's our Easter for Christians, so it's quite a busy time for people, and I would say a very spiritual time. And I've said that word already, and I'm reinforcing it. I'm also going to highlight that this month is International Caesarean Awareness Month, and in UK, I'll just remind you, 1 in either 3 to 4 births is a caesarean section now, and it's important to be able to support families, women and families, to have a safe and a positive experience. And I'll push you towards the All for Maternity resources, because they've got a whole lot at the moment, because it's that month, that you can access. Really good. Also, check out the virtual International Day of the Midwife. Now, all of these are on your resource page, so that's very useful. Also, there's something else on that resource page, which is something Sam is working on, and there's a little link there that you can go to, and I suspect she might mention it in her session a bit later. So do have a look at that, and if you're a student, do contribute to that, because that's what she's wanting for a piece of work she's doing. Also, I'm pushing you to have a look at, this is some homework for you. I like to give it, this is me being a teacher. There we are, some homework. This is the 3-year delivery plan for maternity and neonatal services. And this came out last week. It's also, there's a link on your resources page. It's not too hefty to read. There's a summary, and it starts off with compassionate and therefore safer care for women and families. And I would suggest for midwives and student midwives also. Also supporting the workforce to develop their skills and their capacity, and developing a culture of safety for all and meeting the standards. And having sort of reading that, I also was reminded, and I think that's going to come up on the Facebook link. I was just re-looking at a video clip by Florence Wilcock, and if you haven't seen this, it's a TED talk. She is fabulous. This is an obstetrician who is talking about birth being special, and it is fantastic. It's 20 minutes and it's just great. And if you kind of need to have a little recharge of your midwifery batteries, have a look at this. And again, the link is on your resources. So I'm going to sort of start off there, leaving you with your homework, because I think this session this evening is going to be really interesting. And we're going to be looking at a student-led model of learning for student midwives in the form of student-led postnatal care or postnatal clinic. Now, that's 2 things that are going to be very important. One is the student-led bit of it, and the other bit is postnatal care, because we've talked about postnatal care and the need to have better care for women and their babies. So this is very close to my heart here. We're also going to learn about the SMiLE clinic, which provides student-led postnatal care supported by midwives in partnership with women and families. So I have a lovely double act, and I'm going to introduce them together. And the first person is Dana Colburn, who is, she's been a community midwife, she's been a midwifery lecturer, and she's now a postgraduate researcher and lead midwife She was also in the Royal Navy previously. I'm not sure if she's going to mention that. Very firmly committed to education and clinical practice. So she's really going to illustrate the best of both worlds. She's also a tweeter, and obviously, because she's here, she's an innovative midwife. And she is joined by Samantha, or Sam Perry, who's a third-year student midwife, University of Southampton. She's also undertaking a little research project as part of her studies, which you will see on your resource list. She's the Midwifery Society's president and a student ambassador. I don't know how she fits all that in at the University of Southampton. She's been a volunteer previous, I think, for NICU. She's also a first aider, which is very useful around the place. And she's also been a speaker at a previous maternity midwifery festival in 2021, I think, so a little while back. So I'm going to say a big welcome to both Dana and Sam. The screen is now yours. Welcome.
Sue, thank you so much for that lovely introduction. I've got to live up to it now, haven't I? Hello, everyone. We're just absolutely delighted to be here. So I'm Dana Colborne. I don't think I can introduce myself better than Sue did, so thank you for that, Sue. I'll hand you over to my younger colleague. She is my quick mind, I like to call Sam.
So I'm Sam Perry. Yes, do lots of different things. You're right, Sue. I don't always have time for all of it, but I try my best. And I think if you're going to do something, do it right. And I love student voice, so getting involved in anything that represents and speaks for students is at my core. So being a representative for the Student Midwife Forum with the RCM and being president of the Midwifery Society, these are all things that help me spread student voice.
Lovely. Thank you, Sam. So what we are going to share between us is a short PowerPoint, and we're going to basically sort of describe the clinic. So I can obviously give a practice supervisor and a project lead perspective, and Sam is going to bring the lovely student perspective, and we've got some lovely feedback from the women that have attended the clinic as well. So if you just give me a moment, I'm just going to quickly share my screen. Can everyone see that? Can you see that, Sue?
That's coming up.
Brilliant. Okay. So, yeah, thank you so much for having us. So we're going to be talking about initiative that actually happened a decade ago. I want to say a big thank you to Wendy Marsh, because she was the brains behind the initial project many moons ago, when we first trialled it in Portsmouth Hospital Trust along with Bournemouth University. And little did I know that it is still very relevant today, but also how hard it is to get a project going in the NHS for a long period of time. And the reason why I've kept going is I really do believe in it, and hopefully you will see the benefits as we go through this PowerPoint and the discussion. So the SMiLE clinic, it actually stands for Student Midwife Integrated Learning Environment. It is in the form of a postnatal clinic, and it is a form of CLIP in the form of a student-led clinic. And I was lucky enough to be part of that back in 2013 in Portsmouth hospitals. And again, like I said, 10 years on, I'm at Southampton hospitals, and we've learned a lot along the way. So I would say it's evolved. So some of the topics we're going to cover tonight is we're going to introduce you to the SMiLE clinic. We're going to look at the operation of the SMiLE clinic. I'm going to give you some statistics from round about September through to January when the pilot project ran. We're going to look at some service user feedback. Obviously, Sam was going to give us some lovely student feedback and her own perspective of being one of the very first students in the project at Southampton. I can share some of the practice supervisor, because obviously it's not just me, we work as a team, but also some of the benefits, and most importantly, the challenges. I think when you're doing a project, it's so easy just to look at the benefits, but actually the challenges is where you learn the most and where you do those improvements. So that is going to be really, really important. And also, we don't know everything, you know, as the service changes, you know, as midwifery changes, the clinic has to evolve alongside that as well. So we're always going to face some challenges. And then hopefully we can take some questions from various people. So, as I said, the SMiLE clinic is a CLIP model of learning, and it allows students to lead in their learning and the care in a safe space. And that is really, really important. So what we did when we looked at the models, we actually got the idea from our American colleagues. It is a model that's used a lot in medical students' education, but that is not the primary use. Student-led clinics or free-run clinics came about to actually fill a gap for uninsured people out in the United States and Canada and certain countries that don't have a healthcare system like us. So that was a primary function, really, of student-led clinics. And then it soon became apparent that actually it gave so much more. It was a really a good educational tool. And there's been quite a few studies out there now that have looked at the benefits of students and their progression and their confidence if they've actually been part of a student-led clinic model of learning. People sometimes get a little bit anxious because when we say student-led clinics, they obviously just think that we're going to send a bunch of students in that are not facilitated in any shape or form, and that is absolutely not the case. You know, the students are nurtured by a qualified midwife that is a practice supervisor and that has got quite a few years experience in the domain that you would perhaps want to set the student-led clinic up. In this instance, we have started with a postnatal clinic. You know, sometimes you have to risk assess the different areas and just see actually at the start of a project, you know, what do we want to do? We probably want to go for a lower risk environment, and postnatal was probably the best environment to start that project off in. But as you'll notice as we go through the PowerPoint, there is a lot of flexibility in student-led clinic and the way you can design them. Now, this is a really important aspect of SMiLE. It's the ethos of the SMiLE clinic. And again, you know, one of the challenges, one that people sometimes didn't quite understand what we were trying to do. It's not just running a clinic. It's not about that. And I think this really stemmed back from my own personal time as a student. I had a great experience. And I would say the majority of people I worked with as mentors, because they were called mentors back then, they were really helpful and really nurturing. However, I did have a few episodes where I didn't have very positive experiences. And I really learnt from them, because when I did go into education, I always remembered how I felt when someone didn't treat me perhaps how they should have treated me. And what I also observed is that if you provide a really nurturing, kind, respectful and work in partnership, you get the best out of people. You know, people feel safe. They feel psychologically safe to really, you know, ask those questions. There's no such thing as a silly question. I don't know if you want to jump in, Sam, and just have a few words.
Yeah, absolutely. You know, that ethos comes through as a student at the SMiLE clinic. Yeah, as you say, you know, you have positive, mostly experiences with supervisors on placement, and every so often you find someone who you can just tell doesn't really want to have a student with them. You know, perhaps sees a student as a burden rather than an opportunity to, you know, pass on so much great knowledge. And yeah, you come into the SMiLE clinic, and I always say to people, it's kind of like walking into a hug. It's great. You know, it's a lovely environment. As you said, that psychologically safe space, and you know that the team are there to support you in everything you do, and you feel able to, you know, just push your limits in terms of like what you're able to feel you're comfortable in, and you know that you've got that safety net. You know that you know if you're not sure of something, you're going to go ask someone, because they're not going to judge you for that. They're not going to say something funny about it. They're just going to help you. That's great.
Yeah, and it was really important, because I think one thing I've noticed in my time in midwifery, with the student and being a registered midwife, there can be a feeling of a real sort of authoritative hierarchy. And again, I don't think you get the best out of people. Obviously, there has to be a structure, there has to be leaders, there has to be managers. However, I also think that, the majority of our students are mature students coming through the door. They come with an array of experience. And also, I just feel that a lot of what they know is transferable to midwifery care. And the profession, and I really sort of want to unpick that, but also they will teach me as much as I can teach them. So partnership is really, really important, and that's quite a strict ethos. So the right practice supervision is crucial in the SMiLE clinic. It's not just about running a postnatal clinic. So how does the SMiLE clinic operate? Well, again, this can be flexible. So if you're out there and you're thinking, oh, okay, I quite like this idea, it can be adaptable and fit into different types of services. So at the moment, it runs Monday to Friday. So this is the information from our pilot study, 9 o'clock to 5 o'clock, and we're working from the New Forest Birth Centre at the moment. So we have stunning views over the forest. We often have New Forest ponies walking past. It is a beautiful location, especially for women to come and see us and perhaps have a little bit of TLC as well. There's usually 4 students, mixed ability per placement. They have a 2-week placement with us. We have 2 rooms, so we have 2 clinical rooms that we can see women in, and we also have part of a ward that we've made a little breastfeeding hub, infant feeding hub, shall I say, because everyone is welcome. We're very, very inclusive, and they can come if they're having any feeding issues, and we look after them with providing obviously some lovely BFI information. We make them a cup of tea, they have a biscuit, they really, really do get cared for. And we just really speak to them and take a real interest in how they're feeling after they've had their baby. So as you can see, we do have capacities to see quite a few women, okay, and the beauty is around, but everything that is happening in the SMiLE clinic, every woman that comes in will come in perhaps with some different issues, challenges. So the learning opportunities are huge. And the problem that we were seeing was the fact that the maternity support workers were taking vast amounts of our postnatal care. And I remember, and this isn't just recent, this has been going on for years and years. And I thank them for that, because at the time the workload was absolutely huge. But the challenge on from that was the fact that students were not getting routine postnatal care opportunities. So we started seeing students with really low EU numbers that they have to have, as you well know. And we were a bit like, bemused by that, because when I trained, it was very easy to get lots of routine postnatal care opportunities. So, this was a big driver for the educational focus of the SMiLE clinic as well. And it gives students a lot of different opportunities in how we care for women and babies in the postnatal period. Like I said, we can carry out extra tasks like infant feeding support. We have a little bit more time for other assessments. So we could do some mental health assessments, work with the multidisciplinary team. And also we can do telephone calls. So we can check up on women that perhaps don't need to come in or home visit, but they can we can just check up on them on the phone as well. So let's talk statistics. So in a pilot project, people always like to see the numbers. And this is just a small sample, really. So this is from the September up to January 2023. So by this time we were 10 weeks in operation if you take out some leave. And as you can see, I'm not going to read all of them out, that you can see how many women we saw, you know, the babies that were weighed, the newborn blood spots that were taken, babies that needed, you know, some active assessing for jaundice, infant support, and also women that needed emotional support. And because COVID had happened, postnatal care had really changed. And I think a lot of people started seeing phone calls as the norm, you know, no face-to-face contact. And it was like, just because we've been doing it, it was the right thing to do, when actually, when we started the project, we soon realized that it wasn't the right thing to do. These women needed contact, you know, they needed face-to-face contact with health professionals. They needed, you know, just that support, that emotional support, and being in a safe space where they could talk and they could be looked after. Also, what we started to see is that there were some babies that had significant weight loss round about at day 8 and 9, which I hadn't really come across in my career as a community midwife, because we were seeing them so regular. We tend to pick really up really quickly. And that was a worry. And I think that was the hangover from COVID as well, where there was lack of breastfeeding support in particular, but also just lack of contact to the health professionals, to the women as well. What it also gives is it gives students real opportunity to work in a collaborative manner with other health professionals as well. So we do a lot of collaborative work in the SMiLE clinic as well. So Sam, I'm going to hand over to you for some student feedback, if that's okay.
Lovely stuff. Oh, you didn't put my blood spot on there though, did you?
It probably was yours, Sam, to be fair.
So there's the photo of a newborn blood spot test, and you know, it's little things like, you know, trying to take the neatest newborn blood spot test, and a little competition over the 2 weeks between the 4 students, you know, which I won in my 2 weeks. We'll just put that out there. I got my little proud peacock badge, and it's things like that, little celebrations, and you know, challenges to set us, you know, such small things that can kind of just really make you focus on a task. And I just absolutely loved working at the SMiLE clinic. It was an incredible opportunity to consolidate all my postnatal kind of skills. I was really lucky that I'd done a continuity of care, a pilot scheme the year before. So I actually had been out with MSWs in the community doing checks and things, but some of my fellow students had been on the postnatal wards and they hadn't seen women at day 5 and at day, you know, they'd seen a few at day 3, but they'd seen barely any at day 5 or at day 8 or 9, or at 10 or 11. You know, they hadn't really done that further postnatal care. And I think that's sometimes when a woman's almost come out of that fog of post-birth and things settle and they realize questions they have, and you know, they're like, oh, actually no, they are still asking me if I have any questions about this thing, and I do have questions, and a lot more comes up at that point. And the birth center setting, you know, the just slightly less medicalized feel, and you know, it's just so nice and calm, and we're able to take that time with the women to really find out what they need. Yeah, it was really fantastic to be able to do it, and you know, to be able to try and think about managing a clinic as well. So not only just going, right, okay, you're in here today, and you know, here's some patients, off you go. It's, you know, this is your structure for the day. It was actually, you know, we need to build a clinic list. We need to have a look into their notes before they all come for the day. It's all the administrative tasks that we would be doing as practitioners ourselves when we qualify that you don't think about in advance. You know, you don't think about necessarily all these extra bits that go into it. And we were there and encouraged and supported through that to be able to learn how to do it. And by the end of even the first week, we were absolutely bossing it. We were having a great time. You know, we kind of come in and get on with our clinic lists and be able to search it, and it just really build our confidence. I haven't heard a single dot of negativity about the SMiLE clinic from any of my cohort, or from the years below. They've all absolutely loved it, and I think it's flexible for not only third years. You know, myself for a third year, I'd done quite a few postnatal checks, but you know, certainly still had a lot to tick off. As Dana said, you know, it's sometimes hard to get those numbers. And you know, by the end of the SMiLE placement, I'd ticked all my numbers off. You know, I was definitely done there. So it was, fabulous to be able to do that. But the second and first years have said how interesting it is to get that insight into those postnatal experiences, and also see just some normal postnatal. We get some postnatal ward experience, and sometimes our women who perhaps go home just after they've had the 4-hour post pre and postnuptial sats, they go home 4 hours post birth or 6 hours post birth, and you're not going to see those people on the ward. So nice low risk women and their low risk babies, we're not necessarily seeing those on placements in the wards. And sometimes when we're out with the MSWs, that's our higher risk social women, with the extra support teams and continuity teams. So this is just a really lovely opportunity to see what normal is a little bit and give us that baseline of normal. So that then when we did pick it up, on those days, I remember we had one day where we had, I think, a jaundice referral and 2 extra low weight referrals in one day. And we thought it'd all kind of come on us on one day. But, it was really evident when it came up, because, we saw it and we're like, actually, no, this isn't normal. We know all this equipment works. We know everything's fine. And we knew that we had to do those referrals, and we were encouraged to do those referrals ourselves. Again, experiencing how to do those referrals, how to make those phone calls to certain teams and say, can I check this through with you, rather than just, oh yeah, no worries, I'll call them. It's everything was really, the onus was put on us building our learning, and we were encouraged if there was a gap, what do you want to learn about, what do we want to be doing, and we just had fun. It was really good. I can't speak enough for it. It's absolutely something that should be integrated, I feel, across universities across the country. It's a fantastic way of learning. So yeah.
Oh, thank you, Sam. Thank you. And that's what we're striving to do. That's what we're striving to do. We want the students to have a really meaningful experience, but we want to make it a little bit fun. We want them to make it memorable. So they carry on those lovely behaviours in care, when they become qualified practitioners as well. It's really, really important. Hopefully we also lead by example, and we encourage the students to start thinking about what they want to be like when they're practice supervisors as well, especially the third years. So we sort of segregate it into first, second and third years. First years, it's an introduction to postnatal care. The second years, we're sort of pushing the boundaries a little bit, getting them to think about managing, getting them to think about the more complex cases. So I try and align it perhaps with the curriculum that they're learning at university as well. And also the third years, we definitely want to push them towards a little bit more leadership. They have that year as a preceptorship, and then they become band 6, which has an element of leadership within it. So hopefully, they will feel more prepared. We do a lot of work as well with the wider team in the practice education. So I work with a lovely midwife called Jen Lancaster, who is the preceptorship midwife. So she's looking at preceptorships now. She feeds back to me, Dana, actually, what some of the students or the new preceptorships are finding difficult. If I can try and implement something in the SMiLE clinic, I will do that. So perhaps make those students a little bit more confident when they hit a qualification. And also a lovely midwife called Dan Fremantle, who does workforce planning as well. So she's looking at retention, and that's really important as well. So this is not just stands alone, this is part of the bigger picture. And we're very keen to sort of feed in and do our bit to try and help the service as a whole, really. Service user feedback has been phenomenal. We have had 99% rated it excellent, which was the top, and 1% rated it very, very good. And they all felt well cared for. They felt that they were given respect and dignity. They loved the information given, and there was no negative feedback, which was just absolutely delightful. So we must be doing something right. Also, what I did a little bit of thematic analysis, from those feedbacks. The little bit of an academic came out in me, Sue, and what the service users were saying, that they loved the information given, the communicating of care. They all sort of said we were so really friendly but professional, so that sort of lent it to that professional friends that you hear a lot of midwives being called. validating feelings and experiences. They felt listened to, which was really, really important. And they felt that we cared, because we do care about their experience, and that we understood what they were saying to us. And then from then, if some people did need that extra support, we could signpost them, and we could do the appropriate referrals as well. So again, not going to read all of this out, but this was just some of the feedback that we had from the women. So when the women do get discharged from the SMiLE clinic to go back into the community to the health visitor, they all get a certificate thanking them for being part of the student learning journey. And they absolutely thrilled, and they get a sticker as well. So it's baby's first ever certificate. We include dad, mum, partner, and baby. They get a lovely certificate saying thank you, because without them, the students wouldn't be able to learn. So it is very much again, like a little collaborative, little community of practice, and they are very much part of it. And we do really want to thank them for that. The students also get a certificate, to put into their portfolio, saying that they've participated in a placement in a student-led clinic. And as Sam said, we have a couple of little competitions. We always have the best blood spot. We have the Proud Peacock Award for that excellence in clinical technique, as we call it. And as you could see, that was an absolutely superb newborn blood spot test. And we see them all the time in the SMiLE clinic. So, yeah, we have high standards. We have absolutely high standards. And also, from the practice supervisor feedback is I work alongside two fantastic midwives, Sian Fitzpatrick and Penny Newell. And the reason why we like to have a few midwives running it in the week is that it gives students different practice supervision styles. Okay, because they are going to work with lots of different people. And also, I just think, from a practice supervisor, you learn a lot from your colleagues as well as the students. And I think it keeps us fresh. There's new ideas coming in. And I think that's really, really important, not to remain stagnant. We don't want to cruise. This needs to develop and evolve every step of the way. But I just want to say, it's been an absolute pleasure from my perspective. I feel that it's a real privilege to share knowledge and learning with the next generation of midwives. I had a great experience, and I want every single one of the students that comes through the SMiLE clinic to have a great experience too. A couple of benefits and challenges. Okay, again, as you can see, the benefits is the learning. This is a project is all about education. It's educationally focused. It's not about bridging gaps in staffing, and I'm really blessed that Emma Northover, our Director of Midwifery, had that vision. She's made that very clear. She was on side, when we delivered this presentation. So everyone that is behind the SMiLE clinic knows its primary function is education. Okay. And we've got some quite strong characters that really safeguard that, put those boundaries in place. The students come first. And the reason the students come first is because if we deliver good education to students, they will deliver excellence in care. That's how it rolls on. If we don't teach students, quality care, and postnatal care, as we know, has suffered for many years, then the women won't get it. Some of the challenges that we've had is change management. Anyone that's probably undertook a project, trying to get people on side, and also, from doing it from the ground from the root upwards is quite difficult. You do need perhaps a senior manager on side to really sort of help that project along. So we've had, it's been quite tricky because I'm not a senior manager. It's been quite tricky over the years to be able to do that. Obviously, there's sometimes gaps in the service when students are off. We have to think a little bit differently about that. And at the moment, it's only being offered in one sort of area placement, and probably one of our biggest problems, is funding. It is all about the funding. It's making sure that there is a midwife. but it is absolutely cost effective because we see a lot more women because we can. So one midwife can cover 2 clinics with the students, so we can double the amount of women that we're seeing. We have the bodies to do that. And that's been quite evident in our postnatal care, hence some of the beautiful feedback that we're getting. So it is working. And the future of SMiLE. So it is flexible. It is absolutely flexible. It has a flexibility to move to different locations. It works around the wider service, whatever that looks like, you know. It's so, I think if you're thinking about, can I give it a go in my service, I would definitely start with perhaps a postnatal clinic, something a little bit lower key, and then work up. It's adaptable. It can be adapted to different roles and responsibilities. So, you know, we could think about antenatal clinics, booking clinics, parent education, breastfeeding groups, and hopefully even one day, as they have in the States, they have dedicated education units that students run like a mini hospital, really. It's quite phenomenal, some of the things that they've picked up from in the States as well. As I said, the core value of SMiLE must remain in education. And you know, like I said, I don't want to keep repeating it, but I feel so strongly if we get the education right, these midwives will deliver first-class care for our lovely women that deserve it. And I think even more so now I've got a daughter that is 15, you know, it won't be long. Perhaps in the next 10 years, she could be, you know, in the system. She's the next childbearing cohort. And I would only want the very best for her. And I think that we are collectively in a position that we can be a real advocate for education and keep our profession on the right lines. So that's the end of the presentation.
Well, I think there are some questions coming in.
Is there?
So,
right, that's really good. That's really good.
So Dana and Sam, thank you so much. That was really fascinating on several different levels, actually. I loved the walking into a hug. I love that feeling because that really says how safe, and not just safe, but loving the relationship is, which is lovely, because if people like the students and the midwives are feeling like that, women and their families are going to also feel like that, which is fantastic. And the other sort of things that were coming through to me were things like collaboration and working together, which is so important and fantastic and came over so beautifully. Now I know we've had a few comments and a few questions coming in through for you. So I think one comment, there was a comment rather than a question, from Sinead Thomas. Now, audience, I'm looking away from you for a minute because you're coming up on my other screen. So please forgive me for that. Sinead says, I do find it quite interesting that you struggle to get your postnatal EU numbers, as most of us finish those in mid-second year at my university, but I'm glad you found such a positive solution, which sounds to be working really well. And I think that underlines that every area is going to be slightly different. I know in your area, you've used a lot of the postnatal care did go, rather than purely midwifery, into the maternity care support workers, which I think, Dana, you explained, but yeah. I don't know if you wanted to say anything further to that about the numbers, because presumably Sam and her colleagues are now gathering up their numbers beautifully.
Yeah, I think you hit the nail on the head, Sue, really, in the fact that every service around the country will work slightly differently. And they will have different pots of money, and you know, it depends, obviously, the demographics, you know, how many, you know, the population as well. What we were finding is that the students were getting postnatal, but it tended to be higher risk postnatal care on the wards, and it wasn't routine postnatal care. And if you think of, I always think, if you look at the definition of a midwife, it's with women, but our expertise is low risk, isn't it? You know, it's low risk. When things start getting high risk, then we refer them on to our medical colleagues. But I think it's great if Sinead can, her area, she's getting lots. But yeah, in our areas, a couple of the trusts that I've worked with down here, I would say the majority of routine postnatal care did get handed over to the maternity support workers. And I just want to say, Sue, they did a fantastic job. They have done a fantastic job. And when the SMiLE came along and we took some of that back, I think some of them felt quite hurt. That was one of the challenges. And I could really understand that. I could, because they were given something and they have pride in what they do and they liked what they do. Yeah. So, we said that we're not taking it away. We're just working in partnership. But the students, it's a necessity for them to have that learning.
Well, it's a necessity for us as midwives to keep that expertise.
Yeah, absolutely.
And I guess that's the difficulty of balancing when you're giving some tasks to some others, that you keep a good chunk of it for yourselves to keep that expertise. So, it's an interesting area, isn't it? But
absolutely, yeah. Absolutely.
I've got a question now from Juliet Samuel, midwife in Essex. Hi, Juliet. She's a regular with us. And she says, how do you risk assess your clients for the clinic attendance? And do all students, or is it primarily for third year students? I think may have been, because I think you said all ability at the beginning.
All abilities, yes. So, Juliet, that's a great question. Thank you for asking that. It is for mixed abilities, but we would only, if we only had first years out, we'd only run one clinic. So we obviously risk assess their abilities, really. We work with a wider team. We have postnatal coordinators, which are a group of senior midwives that coordinate all the postnatal care around the whole of the service. Okay, so they sort of screen women that would need to come to see us. I manage the students from the other end, so it's peer-to-peer learning. So that's one of the big learning strategies that we use within the SMiLE clinic. So a third year would be paired with a first year, a second year would go with the third year. First years, if they were by themselves, they would always be with a practice supervisor. So the practice supervisor would run the clinic, and the first years would be observing, and then gently coming in to develop some of those roles, giving them some independence into do that. But that would be direct supervision. So yeah, it is a mixture of years. Bearing in mind our third years are going to be qualifying. So again, when you look at the timing of when they're third and second and first years, you would adapt how much supervision they would need. So that's how we sort of risk assess it. And we're all senior midwives. Okay, we're not going to let people do things that they're not capable of doing. Safety, patient safety is always at the centre of everything that we do.
And actually, just as a query for Sam, I'm imagining from the way that's been described, it's a very a really good way of coming in and getting used to going and asking one of your colleagues for a second opinion, as it were. I don't know whether it. I might be I'm not putting words in your mouth. Sam.
No, 100%, 100%. It is. It's as I say, I did the SMiLE clinic as a third year, and I was just at the beginning of my third year, but I'd had some postnatal experience already, and that's the really good thing as well with that kind of risk assessing. That first introduction to the clinic, you sit down with the team and you discuss what your experience is so far coming into this, what your level of comfort is. Would you like someone in the room with you when you're doing your clinic? Would you rather I was just here waiting for you to come to me? I'm here if you need me. What would you like to do? And generally as third years, we're saying, actually, I think I'd like to give it a try. I think I'll be all right, and I'll go in with my mate, we'll partner up and we'll both be in the same room so that we've got another student to check something with if I half forget something. And then if neither of us are sure, 100%, we feel comfortable going around and be like, you know what? And I used to say at the beginning of the thing, my name's Sam, student midwife, third year. This is my colleague, Annabelle, who's third year. And, just to let you know, we have Dana, our registered midwife. She's on site today. Should there be anything I'm not at all sure with, I will pop and check with her. And just reassuring the woman that, we know that we have our own, sphere of practice, we have our own limitations, and that we stick comfortably within that. That's something we need to do. So yeah, we're absolutely encouraged to do that and feel comfortable to do that.
Yeah. And I'm also thinking some of these women watching that learning might actually be interested in becoming midwives themselves. It's a fantastic kind of nurturing experience, I think.
Well, Sue, that's one thing we could do a recruitment program running.
At the end of the thing, how did you find the SMiLE clinic, and would you like to be a midwife?
Well, it's just because you get women who come in to become midwives either because they've had a bad experience or a great experience as a mum, don't you?
Yeah.
So I think their experience might be 99.9% positive in here, as you were describing.
But they absolutely all get assessed. So we go in with them at the very beginning, that first week, so we can gauge abilities, etc. But I can honestly say I have been absolutely amazed. I don't know if it's because I'm getting older. I've been absolutely amazed by how quick our younger students are as well. Even the first years, by the second week, they are absolutely fantastic. They're asking the right questions, they're learning, they do, like I said, lots of peer-to-peer learning as well, collaborative learning, experiential learning by doing, as we know, works really, really well. Such a safe space that anyone can ask anything. There's no such thing as a silly question, because we forget things sometimes. We have great resources with policies. It is absolutely safe. Everything we do is all about safety, and the students completely and utterly understand that as well.
Fabulous. Okay, I'm going to get on to the next question. But Juliet, thank you for that question.
Yeah,
That's
thank you,
fantastic.
Juliet.
Okay, and we've got Christine. Christine is a very clever student or midwife, I think a student, because she's saying, would there be opportunities for elective placements in the SMiLE clinic?
Now, this has come up, Christine. So yeah, again, a lovely question, and some of our colleagues from other trusts have been asking, and it's definitely something we're working on. I would like to see some elective placements coming in, because I would like all students to have this experience, really. Like I said, over the last 10 years, there's been quite a few students that have gone through the SMiLE model, and the feedback has been phenomenal for them, and a lot of them still talk about it today. In fact, I think one of your lecturers, the lovely Claire, at Southampton, she was one of our first students initially in Portsmouth to come through the SMiLE, and she's an avid fan of collaborative learning in practice. So yes, it's definitely something we're looking at, Christine. So fingers crossed, if we can make some more space, then I would welcome with open arms.
Fabulous. So I could foresee there might be midwives and students interested in doing a little bit of a
we've had a lot of interest. I had one of the medical directors saying he would like his medical students to come through.
Oh my goodness.
He said he wants them to develop communication and relationship building with pregnant, with women, but like he wants them to be a big part of it, and he thinks that midwives do that really, really well.
Of course. And Sam, you wanted to say something, sorry.
Yeah, no, that's right. I was just going to say, as well, if Christine, if that's something you feel passionate about in terms of this model of learning, that's the great thing as well. Go to your university and say, I've seen this working, why aren't we doing this here? I would love to go do this as an elective, but actually, why isn't this a thing here? And this model of learning can work elsewhere. Just need to let people know it's a possibility, and you never know, like, go and feed it back. You can only try.
That's a really good point, Sam, actually. So Christine, go back to your university and just share what you've been hearing and suggest it, because again, people are really interested in doing different things to help students to do this sort of thing. Fabulous. Okay, now we've got another comment. This is Lisa Jane Joyce. Hi, Lisa Jane. This would be amazing for antenatal education clinics, as we know this is lacking post-COVID. Absolutely so. Because I think your point, Dana, about trying different things was a really good one.
Absolutely. And I know Lisa from my Navy days. We were both in the Navy together. So hi, Lisa. Hi, Lisa.
Great
question.
This is what I love about midwifery. It's such a warm, small world, isn't it? Fantastic.
Absolutely. Yeah, absolutely.
I feel like
Yes,
I just think
Sam.
it's great. I'm so glad she's here because I hear that she's absolutely doing fabulous on her midwifery course, and it won't be long before she's qualified.
Well done to you then, Lisa Jane. Great.
I was
Okay.
going to say,
Sorry,
part
Sam.
of the part of the COVID cohort here. So, like, you know, I started when COVID first kicked off, and absolutely we've missed out on doing antenatal education and being part of it. And so many of our women say about it and miss it too. I'd love to run antenatal education sessions and be encouraged to do so. So it's a great model that it could be used for sure.
Yeah, fabulous. Okay. And then I've got Jerry Hotham. I hope I pronounced that correctly, Jerry. Could you explain a bit about how you liaise with university and placement facilitators?
Oh, absolutely, absolutely. And again, a great question, because, you know, we have to have a great partnership. I'm really blessed that I work very closely with a colleague, Claire, who's the senior lecturer at Southampton. She sends me off duties. We have regular meetings. So I know all the students when they're coming in. They've actually made it a placement. And they did the same at Portsmouth with Bournemouth University. So, you know, it's very, very easy if you've got someone that wants to take a little bit of time to do that from clinical practice. Usually the universities pick up on the benefits of student learning very, very quickly, and they make it happen. But it's all about good communication, you know, all those lovely skills that we have as midwives, working in partnership, team working. If Claire lets us know if there's any problems, we let her know if there's any problems. You know, obviously every now and then we have a little blip, but we have a great relationship.
Fabulous. Thank you very much. Okay, we've got another Beth Harkness, who says, apologies if I missed this, but how long did it take for you to get the SMiLE clinic up and running?
So I joined Southampton at the end of July. And I actually was brought on board to do some work with student capacity and expansion. As you well know, you know, we've got a chronic shortage, so they're thinking about, you know, how, you know, training a lot more sort of nurses and midwives. You know, we talked about the SMiLE because we knew that it had worked before, and I was asked to take that on, so we had it up and running by mid-September.
Wow, that's fast work.
Yes, it was quick, but because we'd done it before, we'd learned so much, Sue, you know, and this is what I was talking about, those challenges, you know, they're so important, the challenges, because you learn so much. So this time it was a lot easier, but there has been some hiccups along the way, and again, we're adding to that pot of, you know, that the development and knowing what the right thing to do, because each service is slightly different.
No, it's fabulous, fabulous. Okay, now I've got Sylvia. Hi, Sylvia. Says, I'm a first year student. How can I participate in the SMiLE clinic outside my placements? I think that's a similar point to earlier with Christine.
Yeah,
it is. Your university.
Yeah.
yeah. It's about taking those ideas, and I think sometimes in the NHS and perhaps education, we need to be a little bit more receptive, do some active listening of some of these sort of ideas that students and perhaps other members of staff are coming up with, because I think sometimes it can get very dismissed because people are busy. But actually there's sometimes little gems that could transform either learning or clinical practice. So I do think, you know, as a profession, we need to have open ears and take those time to listen to those new ideas coming through. So I would say, take it to your trust, take it to the university and say, have a look at this. Could we do something like it? You know, be bold, have a voice, ask. People can only say no. Fabulous.
Thank you. That's fabulous. Now we've got, so I hope you're happy with that, Sylvia. Okay, comment rather than a question. And this is from Juliet Samuel again. Great initiative. We've just commenced a monthly student-led antenatal class for local women at the university due to a lack of provision in the locality.
Yeah.
Well, supervision is
Good.
given by clinical and academic staff, which is a lovely partnership.
Yes.
Helps to support the challenges in placement capacity. And Jane Marshall says also great initiative. I think this must be Jane and Juliet saying this together. Thank you for that. And then we've got does the program, this is Juliet again, does the program have a specific skills document, or is it incorporated within the program skill set? And I'm wondering if that's linking into the Mora that we talked about last week.
Yeah, so again, because I have some knowledge of curriculum and the Mora standards, yeah, everything we do will have. So what we tend to do is we have a little conflab. The students they do directed learning what they want. So they tell me what they want. I have a great appreciation of the Mora document, so I can sort of help and signpost them, but it's to get them thinking about what they need, so to build their their competence in actually searching in the book. Okay, what could this skill or competency be signed off here? So I don't jump in straight away and tell them what they need to do. It's all about them trying to tell me what they need. So that's what we try and nurture, really. But yeah, I have a great appreciation of the curriculum. And again, I work very closely with Claire at the university, so we can always have those conversations.
Yeah, I was just wondering actually about it, because we were talking about the examination newborn last week. I'm assuming that in this clinic, you're able to do a lot of the holistic examination newborn as well, and help students to get that expertise as well as postnatal examinations.
Well, we could do so, not at the moment. We don't do that at the moment because they do that in a separate place, in this particular trust. But it could be something that we could think about in the future, especially if we were to move into the main hospital setting. But yeah, you can run it however you want. However, you just need to be mindful that you have enough practice supervision.
Absolutely.
And we've obviously got the right training, because a lot of the younger midwives, or starting off their career, they are coming out with NIPE training, where a lot of the older midwives don't necessarily have that qualification.
Okay. Yeah, because
so
we had
there's a little bit of a gap at the moment.
Yeah, that's fabulous. Thank you. Now we're veering towards the end, but I've got one more that I'm going to try and squeeze in, which is Banash Nazmeen. Hi, Banash. And she says, what are the demographics you're caring for, and how do you embed equity in care and in training for diverse experts by experience, i.e. service users and students?
That's a great question, Sam.
Well, it would be from Banash.
That is a great question.
So in terms of diversity care in our trust, we have needing extra support teams known as nest teams, and with the better births, when we found out about 5 times more in terms of women from minor ethnicities and social backgrounds having high risks of morbidity and mortality in pregnancy in the postnatal period, those teams took on women from those backgrounds, so they have a continuity of care plan. So they would be seen by their midwives and the MSWs who work very closely with those teams. So normally within this clinic, it's our women who are outside of those high risk environments. However, that's not to say that there can, again, be something linked in with a nest team embedding perhaps a student day where they did, a student postnatal clinic day. But obviously currently we know that continuity of care provides better outcomes for people from these backgrounds. So that's why we're doing it that way at the moment. But certainly, we do see people from different backgrounds in the clinic, people who perhaps, aren't within those specific ethnicities, but we see people from, white backgrounds who are coming into us, but have perhaps a recent migrants to the country. or don't speak very good English. These are all people that can still be very low risk in terms of their care, but we see them, and so we see those complexities coming through. And also, we see mental health coming through a lot as well, a lot of complex mental health coming through. It's things where sometimes, we need to make sure we're identifying and talking about mental health with these people, because, if they are coming from these backgrounds, or perhaps we assume everything's low risk and fine. And actually, we're having these in-depth discussions with them, getting to know them, because I saw them on day 3. I'm now seeing them on day 5. And I know they told me on day 3 they had a really horrible night and they were feeling really weepy. I'm going to check in on them on day 5. And it's like a mini continuity period with the SMiLE clinic. If you see someone on the list that you saw a few days ago, they're your person, you'll go and help them, and then you'll see them again day 8. And
And I think that's actually, Sam, thank you so much, because that really reinforces the continuity. That is lovely, because I'm seeing how this works, and I'm sure that anyone who's watching is getting a much better understanding and thinking, hopefully, of ways you could integrate it into your own service, maybe thinking about different ways of using this model, because it's a really good one. And it's kind of like an apprenticeship going right back to the history of midwifery. And I have that very much in my mind for some other different reasons, which I'll share with you next series, series 10. But I want to say a huge thank you to Dana and to Sam for joining us this evening. It's been fantastic, because it's like our lovely audience who come up with fantastic questions and comments, as always. And what a fantastic way to finish our series 9. And we will come back, but we are having a little bit of a holiday next week and next couple of weeks. So we're going to be back, I think, on something like the 26th of April. And we're going to be looking, I think that week that we're coming back, we're going to be looking at Entonox, because that's been in the news. So we've got that to look forward to. And I want to say a big thanks to Dana again, and Sam, and also to Amy, who's in the background, making sure everything works beautifully, and to Paul, who's looking after all the questions coming in, and Deborah, who's looking after making sure it all gets out in social media. So big thank you to everybody. And to our lovely audience, thank you for joining us this week. And in the future, you'll have your resources available on the website. And for those of you who like the podcast at 6 o'clock in the morning on Friday, it'll be there. And don't forget to book if you're coming to Ireland in the 18th of April, or to the Midlands in Leicester on the 16th of May. Fantastic programme, I must say. And I have to say a fond farewell. Look after yourselves, especially, and we'll see you soon. Take care.
Thank you.
Thank you. Thanks for having us.
Thanks for having us. It's been great.